Welcome back to the Psychology of Intimacy. I'm Dr. Cohen. This is episode 10 of 14, When Trust is Broken, Trauma and Intimacy. Across this series, we're building one big idea together, that intimacy is not a thing you either have or don't, but a process you build. If you're joining mid-series, you're welcome here, but you'll get the most out of today if you think of it as one piece of a larger picture we're assembling episode by episode. Before we begin, a word of care. Today we talk about trauma and its effect on intimacy. And for some of you, this is not an abstract topic, it's your life. Please go gently with yourself. If at any point this becomes too much, it is completely okay to step away. And I want to say clearly at the outset, this episode is an overview meant to help you understand, not a substitute for the support of a trained professional. If these themes are alive for you, working with a good therapist is not a sign of weakness. It's one of the wisest things a person can do. With that said, we've built this whole series on a single foundation. Intimacy is the willingness to be vulnerable with another person, resting on a felt sense that closeness is safe. So what happens when that sense of safety has been shattered? When the very vulnerability intimacy requires was once exploited or wounded? That is what trauma does to intimacy. It strikes at the foundation. Let me describe the shape of it broadly. Trauma, whether sexual trauma or the relational trauma of being hurt by the people who are supposed to be safe, teaches the nervous system a lesson. And the lesson is the opposite of the one intimacy needs. It teaches that closeness is dangerous, that vulnerability leads to harm, that letting your guard down is how you get hurt. And here is the crucial part. This isn't a belief someone can simply argue themselves out of. It's often held in the body beneath conscious thought, a protective response that was entirely sensible at the time it formed, and that now fires in situations that are actually safe. This is why intimacy after trauma can be so bewildering, both for survivors and for their partners. A survivor may deeply want closeness and find their body bracing against it. A moment that is objectively tender and safe may trigger a response calibrated to a danger that is no longer present. Touch that is meant lovingly may be met by a nervous system that can't yet tell the difference between then and now. None of this is a failure of love or willingness. It is a protective system, doing its job a little too well on outdated information. Recall the attachment blueprint from earlier in the series. Trauma, especially relational and developmental trauma, can shape that blueprint profoundly, and is often connected to the fearful avoidant pattern we named, the agonizing pull of wanting closeness and fearing it in the same breath. Understanding this can replace a great deal of self-blame with self-compassion. The push-pull isn't sabotage. It's the blueprint, drawn under duress. Now let me speak to the shape of healing, carefully and without overpromising. Recovery is real, and it is possible, and it tends to share a common logic. The nervous system has to slowly, safely learn a new lesson, that closeness can be safe now even though it wasn't then. That relearning happens in the presence of safety, at the survivor's own pace, with control firmly in their hands. This is why patience, consent, and the freedom to pause, everything we discussed last episode, are not just nice in this context. They are the actual mechanism of repair. And it's why this work is so often best done with professional support, where the relearning can happen with skill and care. If you are a partner with a survivor, hear this. Your steadiness matters more than your understanding. You will not always grasp why a safe moment became frightening. You don't have to. What helps is reliability, patience, and the demonstrated truth shown over time that closeness with you does not lead to harm. You become slowly part of the evidence that the old lesson can be revised. So the takeaway is this. Held gently, trauma teaches the body that closeness is dangerous, and healing is the slow, safe relearning that it can be safe now. If this is your story, please be patient with yourself, and please don't walk it alone. Good help exists, and reaching for it is courage, not weakness. Support resources are listed beneath this video. Next episode, we step back to a wider view and look at the invisible cultural and religious scripts that shape what we expect intimacy to be.